Hi, I'm Dr. Ron Adams, and today we're going to be talking about peripheral neuropathy. Now, chances are, if you're watching this DVD, it's because you have peripheral neuropathy. So I'm going to make the assumption that you know a little bit about peripheral neuropathy. For those of you that haven't been diagnosed yet or want to know a little bit more information, basically when we break down the words, peripheral means the nerves that are contained outside of the spinal cord. They go down to the extremities, like the hands, or down to the feet. They also go to your internal organs, your heart, your liver, your kidneys, things of that nature. Neuropathy, if we break down that word, neuro means nerve, pathy means abnormal. So we basically have an abnormal nerve condition. What we want to do is find out what is driving that abnormal nerve condition. In other words, what has damaged those nerves that's giving you that burning or that tingling sensation down in the feet, or giving you numbness or tingling in the hands, or weakness in the hands. Most folks that have had peripheral neuropathy for any length of time, they have difficulties with walking due to either pain in the feet, or they'll have balance issues. They'll also have, some of them that we talk to, they have gut issues. They'll have irritable bowel syndrome, they'll have poor digestion, constipation, diarrhea. Some of them have some sort of sexual dysfunction, because those peripheral nerves that we talked about, they not only go, again, to the arms, to the legs, but they go to organs in the body, including reproductive organs. So what we're going to talk about is what we can do to basically help you overcome this condition. Most of you have already probably tried the medications, the gabapentin, the Lyrica, the Neurontin, and those are out there basically to cover up those symptoms that you have. In some cases that can be a good thing, but the problem is still there. My approach is different in that we are treating you and not specifically the condition. If we can find out what the underlying cause of your condition is, whether it's of a neurologic onset or is it of a metabolic onset, a lot of times it's both. Once we figure out what that cause is, then we have a very hands-on approach. We are looking to help that nerve heal as much as it possibly can. One of the other things that we look at on the metabolic side is a lot of our patients that have had peripheral neuropathy or have it are diabetic. So there's a blood sugar issue. Blood sugar is very important for nerve health. If we have too high a blood sugar, then those nerve tissues start to die and they start to deteriorate. So we want to make sure that we keep everything in check. We want to keep your blood sugar in check. Neurologically, we're going to do an in-depth neurologic exam. We want to find out, is the brain functioning like it's supposed to? Is it sending out signals in the intensity and the frequency? Think of your nerves like the electrical wiring within your house. If you walk into your garage, where my circuit breaker is, and you flip one of the breakers, like in my particular house, if I flip the top breaker, that's my kitchen lights. And if the kitchen lights go out, I can replace those light bulbs all day long. But until I turn that breaker back on, I won't have light. So are those nerves sending out signals and receiving signals as fast as they should due to the health of the nerve? One of the other things that we want to look at is, how are you maintaining yourself? Are you becoming lethargic because walking gives you pain? Because the reason that's important is a couple things that our body needs is fuel and activation. Fuel comes in the form of glucose and oxygen. Activation is electrical stimulation of those nerve fibers and also of the brain itself. Now, when we talk about fuel, glucose, just touched a little bit on it with the diabetic folks. You want to make sure that you have a good diet. You're not eating things that are high in sugar, things that break down into sugar. Water, we want to make sure that we take in plenty of water. That is, our body is just like the earth. It's about 70% water. So if we don't stay properly hydrated, how do we expect our body to work the way that it's supposed to? Now, activation. Now, I use the example of electricity in the house. Our brain runs on very small, minute currents of electricity. That's what fires off these neurons, and that's what gets us moving. That's how I can move my hands. That's how I can blink my eyes. That's how I can talk. I can make rational thought. If our brain is not receiving the fuel, and if it's not receiving the activation, then it's not going to work properly. Therefore, those peripheral nerves are not going to work, and you're going to have that pain or that burning in the feet or in the hands. Many of the people that we deal with this condition find that if we can correct those problems, their relief begins immediately. And then once we work with them on a longer process, then they get back to the life that they had before. The beginning part of this DVD, we talked a little bit about, we already assumed that you had the peripheral neuropathy, so we've given you some kind of a kickstart information. We go into more detail on a DVD. Now I believe it's going to be on the left side of the picture here that you're watching, the DVD, we have an information box. Need you to put in your name, put in a phone number and an address, and we'll mail you out the DVD. If you put your phone number down there, we're going to assume that it's okay for us to contact you. Hopefully we can answer any questions that you may have. It's also going to help get you set up for a consultation. We do offer a free consultation where I sit down with you one-on-one and we basically discuss what is your concerns and where do you hope to be. If you want to continue taking the medication, if you want to continue on the same route that you're on, I wish you the best of luck. This is probably not the right place for you. I'm here to help you get back the life that you lost due to peripheral neuropathy. Again, my name is Dr. Ron Adams. I appreciate your time and we hope to see you soon. Thank you.